Now, Indonesia is
Hi, how's it going?
relaxing some of its current restrictions, the PPKM, malls and dine-ins reopening, and even some schools are gradually conducting offline classes. The declining of positive cases and lower bed occupancy rates have contributed to these decisions made by the government. Now, would you say this means that our government is doing well in handling the pandemic?
Well, we have to define first what doing well is. First is we want to see the bed occupancy rate, which is true, it is declining. And also the rate of cases detected per day has also been decreased. But we also have to note that
The rate of testing in Jakarta and also in Indonesia in general is also declining. So we might we might see a false I would say you might see a false sense of security, and we still need to be vigilant. But it's true that given the rates of vaccination, at least in Jakarta, that is nearing 80 to 90% for second dose, and especially for first dose, that is pretty well contained in Jakarta. But we also need to talk about Indonesia as a whole.
Okay, and then if we look at our neighboring countries such as Malaysia, New Zealand, and Australia, they're still on lockdown. Does that mean we still need to worry, or the pandemic is actually has passed its peak, according to your analysis?
Right. We do need to realize our differences with New Zealand and Australia. For example, in Melbourne, as I know of, today they have around 70 to 80 cases, and they're on full lockdown. But we all, of course, cannot afford to do that, and nor that we have ever been in a full lockdown situation. And I don't think full lockdown is a good way to go for Indonesia, especially for our economic recovery. And we do need to also consider the most vulnerable population who are still in an economic hardship because of COVID-19. And also in Malaysia, they are still in lockdown, but they foresee that by September, they would have herd immunity, and that's where most of Malaysians would have a more freely mobility in the society. However, we need to realize that our immunization rate is really far from what we wanted to see. And so we are not comparable with Australia, New Zealand, and even Malaysia. So we do need to be fearing about maybe there's a Delta 2 variant, Delta 3.0 or 4.0, that we need to be aware about. And I think easing the restriction on the mobility right now, it's a bit too hastily done.
Touching on the subject of immunization, we have now done to 62 million people out of 208 million that's targeted. Now, you mentioned before this is still a low rate, but does this mean that the acceleration of the national vaccination program is proven effective? And what other efforts do you think the government should do at this point?
I would say not at all. First off, looking at the 60% of 200 million, or around 30% of the Indonesian population have been vaccinated is true, but we need to see where these people live. The 30% rate is mostly in Java, Bali, where only 60 to 70% of the population lives. But when we go a bit to Sumatra, to East Nusa Tenggara, to Kalimantan and Papua, the rate is pretty much below 20% for the first dose and nearing 11% for. So when we say vaccination, we should really acknowledge that Indonesia is a vast country with a various different regions and also health system capacity. And so what do we need to strengthen and accelerate the vaccination is first to ensure that we do have enough supply. And then with Pfizer coming in September and also now already available in Jakarta, such a vaccine with specific requirement of cold chain supply would need to be supported with adequate cold chain supply at the district and provincial level, which now we don't have yet. So, for example, you need a minus 17 degrees Celsius to transport and to contain Pfizer vaccine. But Indonesia doesn't have that kind of equipment, let alone in Jakarta and in other districts and provinces with even more limited health system supply.
our vaccinators are
equally
equally
distributed.
distributed.
We need to ensure that all districts and provinces have the capacity and also the awareness among the community itself that they need to vaccinate and that they have access to vaccines. So both supply and demand needs to be strengthened to accelerate the vaccination program, in my opinion.